If you're trying to teach a patient a new behavior, maybe you're trying to teach them how to use an inhaler, give the patient an inhaler and have them show you how they do it. If the patient's being put on insulin for the first time, watch them draw their insulin up in the syringe and inject it. So this is part of the patient showing you that they understand the instructions that they're supposed to follow. I've heard of some hospitals in the United States that even have the patients get all their medicines out and show one by one how they're going to take each one after they go home. The next step is, if the patient doesn't get everything exactly right, we need to clarify what we were trying to teach them. And you might need to modify your explanation a little bit if they were having trouble with something. We need to reassess whether the patient understood the information that time, or ask them to demonstrate the behavior again if they weren't able to do it the first time and we had to reteach them. And you actually have to keep doing this until the patient has shown you that they're understanding what you're trying to communicate. Because only then have you actually taught the patient what it is you are trying to teach them. If you don't do all these things, you don't actually know if the patient has understood what we were trying to communicate. How do we train doctors to do this? I want to show a video here. And in this video, this is a video we've recently made for a new research program for the Society of Hospital Medicine, where we're teaching people how to do better discharge counseling when patients go home from the hospital. So there's two parts to this video. One is going to show you what a typical hospital discharge is like in the United States. And then the other is a model for how we should be doing it. So I'm going to have a seat and let you watch this video. And hopefully the interpreter can hear. We'll see when the sound comes on.
Center discharge counseling.
Hey, Mr. Wallace. I just need to go over a couple of things with you before you leave the hospital. What time's your ride coming?
My wife should be here during her lunch hour. I'm not sure when that is.
Hey, Mr. Wallace. Hi, Angela.
Hey.
You guys going over some discharge information? I was just up here seeing Mr. Williams and thought I'd stop by and check in before going down to the ER. What time's your ride coming, Mr. Wallace?
She's taking a late lunch. I'm not sure exactly when.
Okay. Well, we can go ahead and go over some discharge information now. We've changed several of your medicines while you've been in the hospital. Many of them have stayed the same, though. You know the ACE inhibitor, the one we talked about holding because your blood pressure was low?
Yeah.
Well, we can go ahead and restart that. We also stopped your ranitidine. We put you on omeprazole. You can take twice a day for 4 weeks. And then after that, go down to once a day if you like.
You're needed in room 18.
Okay. I'll be out in just a second. Give me just a second.
We also changed your dose of warfarin. So now you're going to take 4 milligrams on Monday, Wednesday, Friday, and 5 milligrams the rest of the week. You get your INR checked at your PCP. You need to get that done in a week or so. We also wanted to start you on some iron to get your blood counts back up. You tend to get constipated, so you can talk to your PCP about that.
You are going to write all this down, right?
Yes. Angel's got a copy of it. She'll give it to you.
Okay.
Listen, it's been great taking care of you, Mr. Wallace. Good luck.
Okay. Oh, hey, Doc.
Mr. Wallace. Hi, I'm Eli. Hey. Angela had to go with the patient to MRI. She wanted me to give you a list of your discharge medications and other paperwork.
Okay.
Sounds like the doctor went over some things with you already. Do you have any questions?
Said something about some ranitidine, something. I don't know. Is that one of my medicines?
Let's see. Lisinopril, warfarin, hydrochlorothiazide, acetaminophen. No, I don't see it on here. Must not be. Are you sure you heard it right?
Now take a moment to reflect on what you just observed. How did this episode of discharge counseling go? What would you have done differently? How clear was the provider's communication? How could they have better handled distractions or engaged the patient's family? Do you think the patient understood the instructions provided? Now let's take a look at an example of more patient-centered discharge counseling.
Good morning, Mr. Stiles.
Hi. Hi, Angela.
Hey. Hi, I'd like to review your medications with you before you go home. We've added a couple new medications and then also made some changes to the ones you were on before. So I think it's important that we go through them.
Okay.
I'm Erin Neal. Hi. How are you related to Mr. Stiles?
I'm his wife.
Oh, great. Well, I'm glad you could be here to review his medications with us. Do you help him with his medications at home?
I do. I put all of his medicines into a pill box for him every week.
Great. Well, he's lucky to have you to help. I brought an updated list of his medications, and it has all of the brand and generic names, as well as the directions and the dose. And also I included information that I think it's important for you to know about. Feel free to stop me as we go over these and ask any questions. Do you have any questions before we get started?
No, let's go ahead.
Great. Well, you have two new medications. One of them is clindamycin, which is your antibiotic, and the other is iron tablets for your low blood counts or anemia. The clindamycin is going to be 4 times a day for 7 days. It can be difficult to take a medication 4 times a day, but it's important that you take them as directed until they're all gone. I think it's easier to remember to take a medicine if you associate it with your mealtime. So you can take it with breakfast, lunch, dinner, and then again at bedtime. It can also be tough on the stomach, so taking it with food could help prevent that.
Okay.
If you happen to miss a dose, take it as soon as you remember, unless it's almost time for your next dose. You should not play catch-up and take 2 doses at once. And there's also a side effect that I'd like to inform you about. It can cause a severe diarrhea. Even though that's rare, it's good for you to know about, and you need to call the doctor if that happens.
You took your lunchtime dose today, so you'll have 2 more doses left when you get home.
Okay.
Yes, that's an important point. So you'll have 2 more doses, and so it's important that you get your prescription filled today when you leave the hospital.
Should I take it with food before I go to bed?
He just likes to have a snack before he goes to bed.
Yes, that should be fine. You can take it with a snack at bedtime. Your other new medicine is your iron supplement for your blood counts. Your bottle will actually say ferrous sulfate. You're going to take this medicine twice a day, and I recommend taking it with food because it can cause an upset stomach. The biggest side effect that people may notice with this medicine is constipation. If you notice that you're constipated, you can always take an over-the-counter stool softener. It can also turn your stool or your bowel movements a dark black color. This is a normal and expected side effect, so don't let that scare you. What questions do you have about the iron?
Can I take it with my antibiotic?
Yes, you can take it with your antibiotic, but you can't take it with your thyroid medication or the levothyroxine. Now we'll go over some of the changes that we've made to your medications. Before you came in, you were taking insulin glargine, 30 units at bedtime. We found that your blood sugars were running low while you've been in the hospital, so we decreased that dose to 20 units. We also stopped your oral diabetes pill, called pioglitazone. The most serious side effect of insulin is getting low blood sugar or hypoglycemia. How do you feel when your blood sugar gets too low?
It's odd. I feel hungry, but I'm also a little sick at my stomach.
Well, because you're also taking metoprolol, the most common signs of hypoglycemia or low blood sugar may not happen to you. The most likely sign that you will feel is increased sweating.
So when your blood sugar is low, you should take a glucose tablet or some juice. It's going to be really important for you and your family to recognize the signs of low blood sugar and know how to treat it.
Okay.
You'll continue taking your other medications like you were before you came into the hospital, except for the pioglitazone. You'll keep taking the lisinopril and metoprolol for blood pressure, the simvastatin for your cholesterol, the aspirin for your heart, and then also the levothyroxine for your thyroid. How do you usually take your levothyroxine at home?
I take it right when I get up in the morning so I don't forget.
That's perfect. We recommend taking it on an empty stomach before breakfast. Also, remember you should not take that medicine at the same time as your new iron tablets. What questions do you have?
So if he takes his thyroid pill in the morning, then he should take his iron pills at lunch and dinner?
Yes, that's perfect. Now, I do this next part with all of my patients to make sure that I've explained things clearly. Can you tell me your 2 new medications and how you'll be taking them?
Let's see. There's an antibiotic, some kind of mycin.
Clindamycin.
Clindamycin and some iron pills. I'm going to take the clindamycin 4 times a day with food, And I need to take the iron pills with food too, and that's lunch and dinner.
That's right. And which medication will you be stopping?
That was my diabetes pill.
Exactly, the pioglitazone. You'll also decrease your insulin glargine from 30 units to 20 units. Mr. Stiles, here's the updated list of your medications.
And here are your prescriptions. Remember to get them filled today.
Thanks.
Let's reflect on this counseling session as well. It illustrates several good take-home points for discharge counseling. First, engage the family as well as the patient whenever possible. Second, communicate clearly. This means avoiding jargon and being specific about instructions. When counseling about medications, clearly discuss new medications and changes that were made to the pre-hospital medications. Third, check in with the patient and family from time to time to be sure you're explaining things well. Ask what questions they have. Finally, and most importantly, take a minute to confirm patient understanding through teachback. As shown in the video, a good teachback has a few key elements. First, make it normal. Practice doing teachback and let patients know you do this routinely. Second, put the burden on your shoulders. It's your job to explain things clearly. It's not the patient's fault if you're unclear or try to convey too much information. Third, be specific. What are the one or two main things for which you would like to confirm understanding? Finally, if the patient has trouble repeating back the key information, teach it again and reassess comprehension. Providing high-quality discharge counseling isn't always easy, but clear communication can go a long way toward improving medication management after.
I want to thank and congratulate our interpreters for doing that. But if you were listening to the interpretation in Portuguese, the pace of the encounter got changed a bit, understandably. But as we think about the two sessions, I'll just reflect a little bit. In the first one, the patient was distracted watching the television. The nurse was going in and out of the room. The doctor was distracted by the noises, by the intercom, by the beeper, by the telephone.